it's not just someone with the patient around the clock. Like, you're helping the whole family. You're helping them, their family, with the healthcare and other things, right? What does that look like?
Right. So the hospice team is actually what's known as an interdisciplinary team. So the way that may also be different from a traditional healthcare setting is quite often if you go to a hospital, they're taking a multidisciplinary approach, meaning you might have physicians with different specialties who come and provide their support and provide their insight, but they may never really confer together. So you might have doctors, you have a pulmonologist who comes to see, and he's focusing on what's best for the lungs, while then the cardiologist comes right behind him. He might change medications because he's doing what's best for the heart. Now, they're both taking a big picture approach, but they're not necessarily sitting in the same room at the same time and having those conversations. The hospice team is about having all these specialists and these different team members coming together in the same room quite often to talk about taking care of the whole person. So the hospice team consists of the hospice physician, a hospice nurse, a nurse's aide, social worker, a chaplain or spiritual counselor, volunteers, and all of the operational team members that help kind of drive this forward. And so what that may look like for some patients is the nurse comes in and they're really focused on controlling symptoms like shortness of breath and pain. Quite often people think hospice is about just dying well, but it's also about living well with the time you have left. And that is helping to be a guide for patients, families, loved ones, and the other healthcare professionals involved in that individual's care to ensure that they understand what options are made available to them, and they can also live a full, complete life with the time they have left with peace, comfort, and dignity.